Since the UK went into lockdown, you may have decided to take up a little bit of exercise, or you may have decided that if you stay in the house any longer, you might end up murdering your family. Because of that, you may have decided to take yourself out for long walks, take up running, or perhaps start doing dance classes from your house. After a while, if you've not been used to this activity, you may find that you do have a little bit of a sharp pain down the front part of the leg, and there's a good chance that you'll have Medial Tibialis Stress Syndrome, also known commonly as Shin Splints. Running along the tibia, there is a connective tissue known as periosteum. Periosteum provides the bone tissue with all the nutrients that it needs to do growth and repair. When you develop shin splints, this connective tissue is slightly overused, overworked, and a little bit damaged. This causes inflammation to the area as well as the surrounding muscles, which creates a sharp pain whenever you walk or run. You'll find this is more prominent during exercise or immediately following exercise. It may be constant and dull, or it may be constant and sharp, or just sharp pains whenever you do any kind of impact. If you do find yourself with shin splints, unfortunately the only thing that you can do to really recover is to rest. There is ways to speed up recovery, such as stretching the muscles surrounding the lower leg, as well as using ice treatment to help reduce swelling and any anti-inflammatories as well. Ideally, we want to try and avoid getting shin splints to start with. By taking the following measures, you may be able to reduce your chance of getting these shin splints and reduce the chance of you getting that injury and putting yourself out for good. Ideally, we want to be able to get our gait analysed. Now, unfortunately, at the moment, the shops are shut, so you will not be able to get your gait analysed. A gait analysis will allow you to see how you walk, and the person in the shop will be able to prescribe trainers that are adapted towards your foot pattern. If you can't get your gait analysed, try and get as much support on your shoes as you can. We want to try and use grass over road. The reason for this is road is going to have a lot more impact, and that is going to increase the chance of you developing these shin splints along the way. If we can, try and mix up impact and non-impact activities within our training schedule. This means that we're not getting all of that impact all in one go. Consider using Pilates. By doing Pilates, you're going to stabilise the muscles surrounding the pelvis as well as the hip area, and that is going to help improve your posture, and you're not going to overstress the leg by running incorrectly. If we can, try and avoid increasing your mileage by no more than 10% per week. Progressively overload your mileage and make sure you have recovery weeks as well, once again mixing it up with non-impact training. The most important thing to do, however, is not to go too hard too fast. If you go too hard too fast and start a new program, there is a good chance this is going to happen. Remember, Rome wasn't built in a day. Walk before you can run, build up slowly, and that way you are reducing your chance of getting injured. Unfortunately, if this was to carry on going on, it is unlikely, but that stress on the tibia can end up developing further, and you may end up getting a stress fracture, which means you won't be able to do your running, your dancing, or walking away from your family any longer.